On August 23, 2024, the world was thrust into high alert as WHO declared a deadly disease outbreak in the Americas. The virus, first discovered in 1955, has reemerged, spreading rapidly through Bolivia, Brazil, Colombia, Cuba, and Peru, with 8,078 confirmed cases and 2 deaths reported. The virus's impact extends beyond humans, affecting animals in Brazil, with fetal deaths and newborns with microcephaly linked to the pathogen. Transmitted by biting midges and mosquitoes, it thrives in natural reservoirs like sloths, non-human primates, and birds, posing a threat to all living beings. The Oropouche virus, primarily found in the Amazon region, is spread by biting insects. It causes fever in humans and affects animals like howler monkeys and sloths. The primary vector is a tiny midge called Chilocoides pariensis, but other mosquitoes can also transmit the virus. The virus does not spread directly from person to person. Once in the bloodstream, it can disseminate throughout the body, potentially crossing into the central nervous system, accumulating in the brain and liver. Named after Vega de Oro in Trinidad, it has caused outbreaks in the Brazilian Amazon. Since the late 1980s, outbreaks have been reported in Panama, Peru, and Ecuador. By 2024, Cuba confirmed cases. From January to July 2024, WHO recorded 8,078 cases, with Brazil reporting 7,284 cases and 2 deaths. Bolivia, Peru, Colombia, and Cuba also reported cases. Public health officials are concerned about cases outside the Amazon region. The virus has been documented in 10 states outside its traditional range. Genetic analysis reveals mutations enabling more efficient replication, potentially leading to severe illness and increased spread by insects. The virus's ability to hide within immune cells may help it evade defenses, and it might be more resistant to immune responses of previously infected individuals. Urban expansion and climate change contribute to the virus's resurgence, creating more habitats for insects that spread the virus. Oropouche virus infection can lead to severe symptoms or complications, typically causing flu-like symptoms. In severe cases, it can cause meningitis. Symptoms appear 3 to 10 days after being bitten and last for 3 to 6 days, with up to 60% of patients experiencing relapses. Currently, there is no specific treatment or vaccine for Oropouche virus. Researchers urgently call for vaccine development. The Pan American Health Organization recommends rest, fluids, and painkillers. Brazil's Ministry of Health advises symptomatic treatment and medical monitoring. Without vaccines, the best protection against Oropouche is to avoid bites from midges and mosquitoes. Infected individuals should use insect repellents to prevent further spread. Health authorities recommend using fine mesh nets on doors and windows, as the midges carrying the virus are smaller than mosquitoes and can bypass standard nets. Wearing long-sleeve clothing and using insect repellents can also help prevent bites. Raising awareness about the symptoms and history of the Oropouche virus is crucial for protecting ourselves and others. If you found this information valuable, please share it with your friends and family to spread awareness. As the Oropouche virus continues to spread, health authorities and researchers are working tirelessly to understand its behavior, contain its transmission, and develop effective countermeasures. The virus's ability to mutate and adapt poses significant challenges, making it a moving target for scientists and public health officials. One of the key concerns is the virus's potential to spread beyond South America. With climate change creating more favorable conditions for the insects that carry the virus, there is a growing fear that Oropouche could establish itself in new regions, including North America, Europe, and other parts of the world. The global interconnectedness of travel and trade further increases the risk of the virus crossing borders, making international cooperation essential in combating this threat. In response to the outbreak, the World Health Organization has issued guidelines for surveillance, diagnosis, and management of Oropouche virus cases. Countries are urged to strengthen their healthcare systems. Early detection and rapid response are critical to preventing large-scale outbreaks and minimizing the virus's impact on communities. Researchers are also focusing on understanding the virus's genetic makeup. By studying its evolution and transmission patterns, scientists hope to identify vulnerabilities that can be targeted with vaccines or antiviral treatments. Developing a safe and effective vaccine for humans remains a top priority. Efforts are underway to improve diagnostic tools to ensure accurate and timely identification of cases, reducing the risk of misdiagnosis. Public awareness campaigns are playing a crucial role in educating people. Simple measures, such as eliminating standing water where mosquitoes breed, using insect repellent, and wearing protective clothing, can significantly reduce the risk of infection. Communities are also being encouraged to report unusual cases of fever or illness to health authorities, enabling faster detection and containment of outbreaks. The resurgence of the Oropouche virus serves as a stark reminder of the ongoing threat posed by emerging infectious diseases. It underscores the importance of investing in global health infrastructure. As the world continues to grapple with the challenges of climate change, urbanization, and environmental degradation, the risk of new and re-emerging diseases will only increase. In the face of this growing threat, collaboration and innovation are more important than ever. Governments, researchers, healthcare professionals, and communities must work together to build resilient systems. By staying informed, taking preventive measures, and supporting efforts to combat infectious diseases, we can protect ourselves and future generations from the devastating impact of viruses like Oropouche. If you found this information helpful, please share it with others to raise awareness. Together, we can make a difference in the fight against infectious diseases. Stay vigilant, stay informed, and stay safe. As the Oropouche virus situation evolves, the global scientific community is doubling down on efforts to unravel the mysteries of this pathogen. One of the most pressing questions is why the virus has reemerged with such intensity after decades of relative obscurity. Researchers are exploring several theories, including changes in land use, deforestation, and the encroachment of human populations into previously untouched ecosystems may have disrupted natural habitats, bringing humans into closer contact with the virus's animal reservoirs and insect vectors. Climate change is another critical factor under investigation. Rising temperatures and shifting weather patterns are creating more favorable conditions for the insects that transmit the virus. Warmer climates can extend the breeding seasons of midges and mosquitoes, increase their geographic range, and enhance their ability to carry and spread pathogens. This could explain why the virus is now appearing in areas where it was previously unheard of, raising concerns about its potential to become a global health threat. In addition to environmental factors, scientists are studying the virus's genetic mutations to understand how it has become more efficient at replicating and spreading. The latest outbreaks have revealed changes in the virus's genetic code, which may allow it to evade immune responses more effectively and cause more severe illness. These findings highlight the need for ongoing genomic surveillance to track the virus's evolution and anticipate future outbreaks. The lack of a specific treatment or vaccine for Oropouche virus remains a significant challenge. While researchers are testing potential vaccines in animal models, translating these findings into safe and effective human vaccines will take time. In the meantime, public health officials are focusing on symptom management and preventive measures. Rest, hydration, and over-the-counter pain relievers are recommended for those infected, while insect repellents, protective clothing, and fine mesh nets are essential for preventing bites. Community engagement is also playing a vital role in combating the virus. Local health workers are being trained to recognize symptoms, educate communities about prevention, and implement vector control measures. Public awareness campaigns are emphasizing the importance of eliminating standing water, using insect repellent, and seeking medical attention for fever or flu-like symptoms. These efforts are particularly critical in rural and underserved areas, where healthcare access, may be limited. The global response to the Oropouche virus outbreak underscores the importance of international collaboration. Countries are sharing data, resources, and expertise to better understand the virus and coordinate containment efforts. Organizations like the World Health Organization and the Pan American Health Organization are facilitating this cooperation, providing technical support and guidance to affected regions. Despite the challenges, there is reason for hope. Advances in technology, such as rapid diagnostic tests and genomic sequencing, are improving our ability to detect and respond to outbreaks. Increased funding for research and public health infrastructure is also helping to build resilience against emerging infectious diseases. By learning from past outbreaks, such as Zika and dengue, the global community is better equipped to tackle the Oropouche virus and prevent it from becoming a widespread pandemic. As individuals, we all have a role to play in this fight. Staying informed, taking preventive measures, and supporting public health initiatives can make a significant difference. By working together, we can protect ourselves, our communities, and future generations from the threat of infectious diseases like Oropouche. If you found this information valuable, please share it with others to raise awareness. Knowledge is one of our most powerful tools in the fight against emerging viruses. Stay safe, stay informed, and take care. Together, we can overcome this challenge. As the battle against the Oropouche virus intensifies, the global community is beginning to see glimmers of progress, but the road ahead remains fraught with challenges. One of the most promising developments is the increased focus on vaccine research. Several pharmaceutical companies and research institutions have accelerated their efforts to develop a vaccine, leveraging advancements in mRNA technology and other innovative approaches that have proven successful in combating other viruses, such as COVID-19. While these vaccines are still in the experimental stages, early results from animal trials are encouraging, offering hope that a human vaccine could be available within the next few years. In parallel, scientists are exploring antiviral treatments that could help manage symptoms and reduce the severity of the disease. Although no specific antiviral drug for Oropouche virus exists yet, researchers are testing existing medications to see if they can be repurposed to combat the virus. This approach has shown promise in treating other viral infections and could provide a temporary solution while more targeted therapies are developed. Another critical area of focus is improving diagnostic capabilities. Rapid and accurate diagnosis is essential for containing outbreaks and providing timely care to those affected. New diagnostic tools, such as portable PCR machines and rapid antigen tests, are being deployed in affected regions to enable faster detection of the virus. These tools are particularly valuable in remote areas where access to advanced laboratory facilities is limited. Additionally, efforts are underway to train healthcare workers in identifying and managing Oropouche virus cases, ensuring that even the most underserved communities are equipped to respond effectively. Public health campaigns are gaining momentum, with governments and organizations educating the public about virus risks and protection. Social media, radio, and community outreach programs disseminate preventive measures like using insect repellent and eliminating standing water. These campaigns address cultural and linguistic differences to reach all population segments. International collaboration is key, with countries sharing data, resources, and expertise to track the virus's spread and develop countermeasures. Organizations like WHO and PAHO coordinate efforts, providing technical support and facilitating knowledge exchange. This collaboration has led to breakthroughs, such as identifying genetic mutations and developing diagnostic tools. Despite advancements, the fight against the Oropouche virus is ongoing. The virus's ability to mutate, climate change, and urbanization pose new challenges. Scientists call for increased funding for research and public health infrastructure. Individuals play a crucial role by staying informed, taking preventive measures, and supporting public health initiatives. Simple actions like using insect repellent and reporting symptoms can significantly impact slowing the virus's spread. Community involvement amplifies public health messages and ensures access to resources. The Oropouche virus resurgence highlights the threat of emerging infectious diseases and the importance of vigilance, innovation, and global cooperation. While challenges are significant, progress shows we have the tools to confront the threat. By working together, we can overcome the Oropouche virus and build a safer future. Sharing information raises awareness and contributes to the fight. The global response focuses on long-term strategies to prevent future outbreaks. A One Health approach addresses the interconnectedness of human, animal, and environmental health, reducing the risk of zoonotic diseases. Governments implement policies promoting sustainable land use, protecting biodiversity, and combating climate change. Reforestation and wildlife corridors restore habitats and reduce human-wildlife interactions. Efforts regulate urban expansion and agricultural practices to minimize environmental disruption, preventing new diseases and contributing to planetary health. Strengthening global health systems is critical. The Oropouche virus outbreak exposed healthcare infrastructure gaps, especially in low and middle-income countries. International organizations invest in developing robust systems for quick outbreak detection and response. This includes training healthcare workers, improving laboratory capacity, and ensuring access to medical supplies. Surveillance and early warning systems are enhanced to detect potential outbreaks before escalation.